I know that many of you are worried about the spread of the coronavirus that originated in China and appears to have taken hold in the United States and many countries around the world. I share your concern, and I want to assure you that I have been in constant contact with our local, state, and federal public health professionals. I have tremendous confidence in the public health professionals at every level of government, federal, state, and local. They are working many, many hours to make sure that we monitor those symptoms and those with likely exposure to others who are infected. They are gearing up to make sure we have the supplies we need, to make sure that we have adequate testing resources in California, and to provide space for those who need to be quarantined despite showing no symptoms. And they have been particularly focused on public outreach to keep the public informed about the status of the virus and the best practices to safeguard against becoming infected. I can assure you that I am advocating for the resources and speedy responses that we need to make sure we limit the virus's spread and to treat those who become infected. Congress is working to pass significant emergency appropriations legislation to combat the coronavirus, which I hope and expect the President will sign. While the mortality rates are too early to calculate, studies have shown that 80% of those infected by the coronavirus will only have mild symptoms. Studies have also shown that infected people could show no symptoms at all. With that said, the virus spreads very easily, and with many infected people showing no symptoms, it spreads and can be silent. So while we should not panic, we must be extremely vigilant in following the recommendations of our public health experts. That includes avoid close contact with people who are sick, avoid touching your eyes, nose, and mouth, stay home when you are sick, cover your cough or sneeze with a tissue, then throw the tissue in the trash. Use a regular household cleaning spray or wipe to clean and disinfect frequently touched objects and surfaces. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, or after blowing your nose, coughing, or sneezing. I encourage you to visit my website at juliabrownley.house.gov, where we can find more information on the coronavirus. To keep yourself informed, I also encourage you to visit the U.S. Centers for Disease Control and Prevention website at cdc.gov. I want to assure you that I am taking this situation very seriously and that I'm here to answer your questions or provide assistance where possible. Please contact my office at 805-379-1779 if you have any questions or if you need assistance. Thank you very much.